Chapter 14, The Face and Superficial Neck. Question 1. Which of the following structures travel through the substance of the parotid gland? A. The maxillary artery. B. The maxillary artery and retromandibular vein. C. The maxillary artery, retromandibular vein, and facial artery. D. The maxillary artery, retromandibular vein, facial artery, and buccal branch of the mandibular nerve. Correct answer is B. The maxillary artery and retromandibular vein. The maxillary artery is one of the terminal branches of the external carotid artery which divides within the parotid gland. The retromandibular vein is the vein corresponding to the external carotid artery within the gland. The buccal branch of the facial nerve arises within the gland, but the buccal branch of the trigeminal mandibular nerve does not pass through the gland. The facial artery is closely associated with the submandibular gland. Question 2. A patient with damage to their cervical sympathetic chain will show the following signs and symptoms. A. Pupillary constriction. B. Pupillary constriction and vasodilation of facial vessels. C. Pupillary constriction, vasodilation of facial vessels and increased facial sweating. D. Pupillary constriction, vasodilation of facial vessels, increased facial sweating and decreased lacrimation. Correct answer is B. Pupillary constriction and vasodilation of facial vessels. Unopposed parasympathetic action will produce papillary dilatation and facial vessels will dilate because of lack of sympathetic tone. However, this is not accompanied by facial sweating as might be expected because facial sweat glands are innervated by sympathetic neurons. Lacrimation is increased by parasympathetic stimulation. Question 3. A lesion causing compression of the facial nerve at the stylomastoid foramen will cause ipsilateral. A. Paralysis of the facial muscles. B. Paralysis of the facial muscles and loss of taste. C. Paralysis of the facial muscles, loss of taste and lacrimation. D. Paralysis of the facial muscles, loss of taste, lacrimation, and decreased salivation. Correct answer is A. Paralysis of the facial muscles. Sensory branches supplying taste buds on the anterior tongue and parasympathetic branches to the lacrimal and sublingual and submandibular salivary glands arise from the facial nerve in and around the middle ear, so will not be affected by a lesion at the given site. Question 4. Which of these branches of the trigeminal nerve contain somatic motor processes? A. The supraorbital nerve. B. The infraorbital nerve. C. The mental nerve. D. None of the above. Correct answer is D. None of the above. These three branches are the major cutaneous sensory branches of the ophthalmic, maxillary, and mandibular divisions of the trigeminal nerve respectively. They are all purely sensory nerves. Question 5. On which surfaces of the teeth is dental plaque most likely to accumulate in the mouth of a patient with poor oral hygiene? A. The palatal surfaces of the upper molars and lingual surfaces of the lower incisors. B. The buccal surfaces of the upper molars and lingual surfaces of the lower incisors. C. The palatal surfaces of the upper molars and labial surfaces of the lower incisors. D. The buccal surfaces of the upper molars and labial surfaces of the lower incisors. Correct answer is B. The buccal surfaces of the upper molars and lingual surfaces of the lower incisors. Major plaque deposits accumulate where saliva is most abundant, which is where it enters the mouth. The parotid ducts open opposite the buccal surfaces of the maxillary molar teeth, and the sublingual papillae marking the opening of the submandibular ducts are adjacent to the lingual surfaces of the mandibular incisor teeth. Question 6. The parotid duct runs A. Deep to masseter and enters the mouth opposite the upper second molar. B. superficial to masseter and enters the mouth opposite the upper second molar. C. Deep to masseter and enters the mouth opposite the upper second premolar. D. Superficial to masseter and enters the mouth opposite the upper second premolar. Correct answer is B. Superficial to masseter and enters the mouth opposite the upper second molar. The parotid duct is a superficial structure and may be palpated as a cord-like structure against a clenched masseter muscle. The duct enters the mouth opposite the upper second molar tooth.